In this class, we are going to discuss about sympatholytic drugs. In last class, we have discussed about sympathomimetic drugs, where I have discussed about how sympathomimetic drugs work and what is the meaning of sympathomimetic drugs. Sympathomimetic drugs was that drugs which are going to do generally the same work as done by autonomic nervous system, or you can call the action of sympathetic or sympathomimetic nervous system work is done by the same action. That same action will be done by the sympathomimetic drugs. But today we are going to discuss about sympatholytic drugs. That drug is going to do the opposite action is that of autonomic nervous system or sympathetic nervous system. That means in our body, autonomic nervous system, in that sympathetic nervous system, what the work generally done by them, that sympatholytic is going to oppose their work by its own activity. That means sympatholytic drugs is going to do the opposite actions is that of sympathetic nervous system or autonomic nervous system. By the name only you can understand that sympathetic is come from sympathetic nervous system and the lytic is mean of opposite or oppose. That means that are the drugs which are going to oppose the action of sympathomimetic drugs or sympathetic nervous system by their action. So they will do the opposite action as that of sympathetic nervous system. So now we will go to into the main part of sympatholytic drugs. First, we have to understand how that drug is going to act. In previous class and during the introduction class of autonomic nervous system, I have discussed about different receptor acting on that. In that ANS, the main topic we are going to discuss today or is important for sympatholytic and sympathomimetic is sympathetic nervous system. In that sympathetic nervous system, we studied about two types of receptor. One is alpha receptor, another one is beta receptor. In that alpha receptor, that was alpha 1 and alpha 2, and in beta receptor there are three types: beta 1, beta 2, beta 3, where they generally situated and what are their action you can study from the previous classes where I have discussed about sympathomimetic drugs, or you can also study all about all this receptor in the introduction part of autonomic nervous system. So I am not going through that details, so you can study all these things from the previous video. Today I am just going to discuss about the main topic that is important for the sympatholytic drugs. Now we have to know or we have to discuss about the physiological action that is generally showed by the sympathetic or sympatholytic drugs. Their physiological action now we are going to discuss. So about that you have to understand the different receptor and what they are going to do. Sympathetic or sympatholytic drugs, how they will work, they will oppose the action of sympathetic nervous system by inhibiting the action of alpha receptor and beta receptor. In that alpha, both will be there, alpha 1 and alpha 2, their name also will be blocked, and beta 1, beta 2 and beta 3, their work and their function also will be inhibited by the sympatholytic drugs. So that sympatholytic drugs are also known as adrenergic antagonist or adrenergic receptor blockers or alpha beta blockers, and they are also called as anti-adrenergic drugs because they are going to do the anti, that means the opposite work of adrenergic receptor, that can be alpha and beta both function or can be selective or non-selective. So what are their action? So according to the different receptor, we have to know or we have to check the different physiological action of sympatholytic. So if we are considering selective, that it can be alpha selective or beta selective. In that also it can be alpha 1 selective or alpha 2 selective, or beta 1 selective, beta 2 selective, or beta 3 selective. According to that, different physiological action will be shown. Alpha 1 blockers. that alpha 1 blocker sympatholytic, they will show vasodilation. That vasodilation will lead to hypotension or decrease of blood pressure. Now, in term of alpha 2 antagonist, that will show the physiological action of tachycardia, and also it will inhibit the release of noradrenaline or norepinephrine. Now, in case of beta 1 blockers, what physiological action they will show? They will decrease the heart rate or decrease the cardiac output. In term of beta 2, they will show bradycardia. And in case of beta 3 blockers, they will inhibit the different physiological process in our body, especially lipolysis and glucogenolysis. So I have discussed about the different physiological action of sympatholytic based on the receptor. If that is alpha 1 antagonist or alpha 1 blockers, that will do vasodilation leads to decrease in blood pressure. For alpha 2, it will go to release or decrease the release of noradrenaline. It will leads to tachycardia. In case of beta 1 blockers, it will decrease the heart rate and decrease the cardiac output. In case of beta 2, that will show physiological action of bradycardia. And in case of beta 3 blocker, that will block the different process in our body such as lipolysis and gluconeogenesis or glucogenolysis. Now we are going to discuss about their therapeutic effect or why they are used in our body, because we know our main body or our main work is adrenergic receptor work, but they are generally doing the opposite of the action of adrenergic receptor. But then why we have to use that drug in our body? Because they also have different therapeutic effect in our body. That's why that sympatholytic drugs are also important and they are also consumed by us. So now we will discuss about the therapeutic effect of sympatholytic. Suppose I am going to discuss in two parts. One is sympatholytic drugs, which generally blocks the alpha adrenergic blocker. Then we will discuss about the therapeutic effect of sympatholytics, which generally show their action by blocking the beta receptor, or we call as beta antagonist. So now we are going to discuss about their therapeutic effect. In case of alpha 1, that will use in treating hypertension, or that we call as BP. So decreasing the BP if anyone's blood pressure is increased. So to vasodilate or dilate their blood vessel, we can use alpha 1 alpha blockers or sympatholytic that will decrease the hypertension and will regulate the BP. Then the another work is they will use to treat congestive heart failure. And alpha antagonists, they are also used to treat peripheral vascular diseases. So what are the therapeutic effect of alpha blockers and sympatholytics? First one is they will decrease the hypertension by promoting vasodilation. Then they will also use in treating congestive heart failure, and also they will use in treating peripheral vascular diseases. Now we are going to discuss about the therapeutic effect of beta blockers or sympatholytic beta blockers agent. So what are their therapeutic effect? They are going to use in treating angina pectoris. What is angina pectoris? That we are going to discuss into the upcoming classes when we are going to discuss about specific drugs. Angina, just remember, angina is a disease when our heart is not getting sufficient of oxygen, that our heart will be insufficient of oxygen. And we all know blood is the generally provider of blood to the oxygen of the heart. So blood will carry the oxygen and that will reach into the heart. In angina pectoris, in the heart, blood will not reaching in that heart in sufficient amount. For that, what it will happen, the amount of oxygen required by heart will be decreased there, so it will leads to the insufficient action of heart, that can leads to the pain or ischemia, that is called as angina pectoris. To treat the drug, beta blockers or sympatholytic beta blockers can be used. There are also different action, also there can be used also to treat cardiac arrest or myocardial infarction. So beta blocker also can be used to treat myocardial infarction or cardiac arrest. That beta blockers also can be used to treat arrhythmia. That also we are going to discuss in later about the drug. What is arrhythmia? Arrhythmia is irregular heart rate. In that, what it will happen in our body, that heart is going to beat in high amount or sometimes it will beat in low rate. So their rate will be irregular. That irregular cardiac rhythm is called as arrhythmia. So that beta blockers also can be used to treat arrhythmia. Another one is it can be used also to treat glaucoma. So what is glaucoma? Glaucoma is a disease related to eye. What it will happen in that glaucoma, the vitreous humor in our eye is going to dilate. So what it will happen, it will leads to the dilation of eye. So it will leads to the cataract or failure of eye. So as people due to the glaucoma, they will be blind because their vision will be destroyed by the cause of glaucoma, because that will lead to the effect or destructive of vitreous humor, that eye can't work, so you can see, it will lead to blindness, that is called as glaucoma. So beta blockers, sympatholytic, can be used to treat angina pectoris. They are also can be used to treat cardiac arrest or myocardial infarction. They can be used to treat cardiac arrhythmia or irregular heartbeat. They also can be used to treat glaucoma and can help you to decrease eye diseases, so that eye can be work very well and you can see everything. So by that I have discussed about the therapeutic effect of alpha and beta. Now we are going to discuss about different examples. So based on different classification, we are going to discuss about different examples. So there are different classifications. What are they? First one is centrally acting sympatholytic. So they are going to act in central nervous system and going to inhibit the action of adrenergic receptor, and it leads to the action of sympatholytic drugs. Example is clonidine. That clonidine is also used to treat hypertension or to treat high BP. The second one is selective alpha blockers. Selective alpha blockers mean that can be alpha 1, that can be alpha 2, and that can be alpha 3. In that case, sympatholytic drugs will see the opposite action of sympathetic nervous system by blocking alpha 1, alpha 2 and alpha 3 receptor. Example is prazosin. How that prazosin work? That prazosin is going to show the opposite action of adrenergic receptor or adrenergic nervous system by blocking the action of alpha 2 adrenergic blockers. The third one is selective beta blockers. It can be beta 1, it can be beta 2, or it can be beta 3. Example is propranolol. And that propranolol is also used to treat angina. This is also used to treat cardiac arrest. This is also used to treat hypertension or BP. They generally showed their action and showed opposite action of sympathetic nervous system or adrenergic receptor action by blocking the action of beta 2 receptor. So that propranolol and clonidine, that both can be used to treat hypertension or lowering BP. Now we will study about non-selective sympatholytic. Here what it will happen, it can block the action of alpha 1, or it can block the alpha 2, or it can be beta 1, beta 2, beta 3. So they can show their action by inhibiting alpha 1 or beta, or they can inhibit the action of both alpha and beta. That means it will also inhibit the action of alpha 1, 2 and beta 1, 2, 3 and will show their action. Example is leventalol. This will block the action of alpha receptor and beta receptor, which is going to lead the inhibition of or inhibiting the action of alpha 1 and alpha 2 receptor, and also beta 1, beta 2 and beta 3 receptor. One more classification of sympatholytic is directly blocking adrenergic neuron action. So what it will happen here, that drug will not bind with alpha or beta or any other receptor. What it will happen, it will directly inhibit the synthesis of adrenergic neuron action. When that adrenergic neuron will show less action, that time adrenergic receptor can't be produced. It can be alpha and beta both. So due to the decrease or due to the inhibiting action of adrenergic neuron, they can't be release the alpha 1, 2 and beta 1, 2, 3 receptor. It will lead to the opposite action of adrenergic receptor or sympathetic nervous system. So this was the 4 type of sympatholytic drug. The last topic we are going to discuss today, that is about different adverse drug reaction of sympatholytic drug. According to classification only, we will study about the adverse drug reaction. We all know what are adverse drug reaction. Adverse drug reactions are the reaction or the effect shown by drug which is generally unwanted, undesirable and very toxic for our body. The drug should not show that action, because that are action that we generally are not desired for. All that are called as adrenergic or adverse drug reaction. So now I am going to discuss about adverse drug reaction of sympatholytic drug. So what are they? Are adverse drug reaction. According to classification only, we will going to study adverse drug reaction in case of alpha blockers sympatholytic. There can be sedation, there can be extreme low BP, or it can also tell like hypotension. That is also can cause dizziness and also can cause tachycardia. Now we are going to discuss about adverse drug reaction related to beta blocker sympatholytic, like bradycardia, fatigue, and also bronchospasm. That adverse reaction generally showed in case of treating asthma. If you are taking asthma drug which is what they are talking beta, that sympatholytic drug over exhaustion of that beta sympatholytic will lead to the adverse drug reaction of bronchospasm. Now, the last of adverse drug reaction is the drug which generally inhibit the action of adrenergic receptor. Example is reserpine. Tell about the example. The example of drug generally directly inhibiting the adrenergic receptor is reserpine, and the adverse drug reaction related to this is depression and different gastric problem is related to the overconsumption of reserpine that comes under directly drug acting on adrenergic neuron inhibitor. So by that I have discussed about the sympatholytic drugs, their physiological action, their therapeutic effect, their classification with proper example, and at last we have discussed about the adverse drug reaction related to the sympatholytic drug. So by that I have finished off the topic sympatholytic. From the next class I am going to discuss about the drug which generally act on parasympatholytic. In that, two types of drugs generally come, parasympathomimetic drugs and parasympatholytic drugs, that I am going to discuss into the upcoming classes. In next class the topic will be parasympathomimetic drugs. For today, that is your topic, that is sympatholytic drugs. Go and check it out, that topic. Before that I am recommend you to check the previous video about introduction of adrenergic receptor or autonomic nervous system, then go to the sympathomimetic drugs and then come to that topic of sympatholytic, so you can better understand the topic of sympatholytic. Thank you.